So what do you do if you come across a crash and someone is injured?
Well, we learn the same thing as you do. DRSABC.
As you can see, this PDF is put out by the Australian Resuscitation Council. It's exactly the same thing that you do in a cardiac arrest or any other bad emergency as what you should do in a bad car crash.
So let's start with D, danger. First, have a look around. Take 20 seconds to park your car safely, put on your hazard lights, and have a look at the crash scene. Put on your gloves.
Yep, that's part of D, that protects you. And it's not like in the movies. In the movies you see someone skids to a halt and goes racing through the flames to do something emergency treatment. It's never like that in real life. We really mean it, what Lisa just said about taking 20 seconds. You've always got a bit of time to think about what's going on. Look around, look for what other dangers there are. Look at what could hurt you, look at what immediately could hurt someone else around. Spend that time.
Because you don't want to become a patient as well. And then response. Have a look at the passenger, have a look at the driver. How are they responding? Call out to them. Maybe you need to give them a bit of a shake. They're not responding.
The next one is S, send for help. Ring 000. When you ring 000, there is a set pro forma of questions that you will be asked. While you're ringing that, just answer the questions honestly and they will get the most information out of you as to what is the best way to deal with it. Once you've done DRS, we come to A for airway. Now, one of our workers, Ebony here, is in the car, and you can see from Ebony that she is unconscious with a head slump forward. Airway is that part of your body that goes from your mouth down to your lungs. What it is it's a tube, and the tube needs to be straight. If you're leaning forward like Ebony is, often it becomes kinked, and air can't get in and out. So that needs to be straightened. You also need to look for breathing. You need to look at Ebony, and if you look at Ebony, you can see her chest is moving, but she's also making these noises. Those type of snoring noises often mean that someone's airway is blocked. So what you want to be doing is what Lisa's doing now. Go behind and carefully lift her head up, unkink her trachea, unkink the airway, and often then the noises will stop and air will go in and out nicely. And now, because you've opened up the airway, she can breathe properly. You notice that what Lisa has done with Ebony's chin is it's now level with the ground. It's now in a neutral position. What Lisa has just done is a truly life-saving manoeuvre, which is simple to do. You don't need much equipment. You don't need any equipment really. And you don't need much training. It's nothing fancy, but it is truly life-saving. But what you may well find is you now need to stay there and hold the airway open until the emergency services come and until they can take over and until somebody who is trained in it knows what they are doing. They will come, they will help, they will take over, but it might take some time. In order to hold her airway still and her neck still, what we often use in emergency services are collars like these. These are designed to keep someone's head in a neutral position for the time it is necessary until we can make sure they don't have a fracture of their spine. So to put it on, what we do when you're sitting in a car is while Lisa is holding the head still, we come up from in front, push that under her chin and hold it, and then there's a bit of Velcro on this side which slips on and it just stays there. And you can see it's holding her head nice and straight in a neutral position. And if you're ever in a car crash, all the emergency services will arrive with one of these and will be putting it on. So if you're ever at a car crash, you may well need to be holding the head still until the emergency services arrive, and eventually they will say, it's okay to let go now. So Lisa, you can let go now. So the next letter after A for airway and B for breathing is C for circulation. And the important thing in a car crash for circulation is stop the bleeding.
And obviously, this is a mannequin, but if I was to come across a real person that was bleeding like this, I'd grab something from my car, maybe a clean shirt, maybe a combine just like this one, or a crepe bandage, put it over the area of bleeding and press down, nice pressure, and I wouldn't let it go.
No. You may well again be holding that until the emergency services arrive. But that is the crucial part about C for circulation when it comes to car crashes, stopping the bleeding. That is something, again, which is truly life-saving. Don't have to worry about tourniquets or pressure points or any of those other things that you might have heard about, just pressure on the area that is bleeding. So just to reiterate, it's exactly the same DRSABC as you've been taught in any first aid course or what you would do in a cardiac arrest or any other emergency. But the important things to really remember about car crashes are opening an airway, particularly if somebody is stuck sitting up in a car, and when you get to circulation, stop the bleeding. They're the crucial things in first aid when you first get to a car crash.